Namaste, I'm Dr. Sarina, your ENT and facial plastic surgeon, and this is Ready to Review. Here I talk about published medical articles and papers that I've read and found interesting to share with my audience. I hope you enjoyed this segment. Let's go. Today, let's talk about chronic nasal pain after nasal trauma or nasal surgery. Acute pain persisting for about 1 to 2 weeks after nasal trauma or septorhinoplasty is considered normal. Chronic nasal pain is a delayed onset, intractable pain that presents within 3 months after septorhinoplasty or nasal bone trauma. This has an unknown pathogenesis and sometimes also considered as a psychosomatic manifestation. This is a complicated clinical issue and is also thought to be of a neuropathic origin. This is why I felt it was important for me to talk about this particular article, Management of Chronic Nasal Pain Developing After Rhinoseptoplasty or Nasal Trauma. This is a study done in South Korea by famous South Korean rhinoplasty surgeons, Dr. Kwon and Dr. Zhang. They have done a study on 28 patients, out of which 12 were males and 16 were females, ranging from the ages 22 to 66 years. And these patients developed chronic nasal pain after rhinoseptoplasty. They defined chronic nasal pain as a pain persisting for more than 4 hours in a day, for more than 15 days in a month, for more than 3 months. Initially, they started their treatment with non-steroidal anti-inflammatory drugs and acetaminophen. Investigations such as nasal endoscopy and CT scan of the nose were also done, but in the findings of these investigations, there was no evidence of inflammation, infection, or surgery-related issues. They mentioned that the specific sites of the pain included the nasal dorsum, the lateral sides of the nose, and the nasal tip, but the pain could also happen in the nasal septum, the periorbital regions, and the cheeks. The characters of the pain could be either pressing type, stabbing type, squeezing type, burning type of pain, and the pain could either be continuous or intermittent. They proceeded with their treatment for 1 to 3 months with gabapentinoid drugs and local nerve blocks. The pain scoring was based off a pain-related numerical rating scale, and in their results, 68% of the patients, after the completion of the treatment, they experienced some kind of relief. Out of this, 12 of the patients experienced complete relief after the treatment session, 3 had moderate relief, 4 had only mild relief, whereas 9 of the patients did not experience any kind of relief even after the completion of the treatment. A wide range of conditions can result due to the injury of the peripheral and the central somatosensory nervous system that leads to such kind of neuropathic pain. These can also cause sensations such as hyperpathia, hyperalgesia, and allodynia. This type of chronic nasal pain has also been termed as traumatic nasal pain or traumatic nasal neuralgia or traumatic external nasal pain syndromes, etc. This can happen due to nasal bone fracture or even after surgery due to some surgical steps such as osteotomies, augmentation, or hump reduction, or also implant-related tissue contractures. Like I mentioned earlier, manifestations of the chronic nasal pain can be of different characters, and it can also be either continuous or intermittent, and the time of onset can also vary from patient to patient. Here's a shout out to Dr. Sangam Rayamaji, who is a plastic surgeon and a colleague. He discussed with me about Charlin's syndrome, which is a nasociliary neuralgia. In this, the patient experiences severe pain in the face and the head, especially around the nose and the eyes. This is triggered by irritation to the nasociliary nerve, which can happen due to injury to the external nasal nerve. Nasal pain is also accompanied by rhinorrhea, which means runny nose, and it typically affects one side of the face. This has a challenging treatment accompanied with medicines, nerve blocks, and sometimes even surgical and chemical nerve ablations need to be done. Even after treatment, the pain does resolve in a few patients, whereas some patients do experience pain for an extended period of time. I would also like to take this opportunity to inform you guys that I have achieved a certification in headache and facial pain management. In this course, I learned about several nerve blocks for facial pain and headaches, and especially the use of Botox in the prophylactic treatment for migraine. If you'd like to know more about Botox and migraine, please let me know down in the comments below and I'll make another video on the topic. Coming back to chronic nasal pain, the authors of this article, they have done a splendid job in explaining about chronic nasal pain, their characters, and the treatments that they have used, and they have also mentioned about the limitations of the study. I really applaud how they have presented their research. Chronic nasal pain is a complication that can happen to anyone, and more study is being done throughout the world regarding the causes of chronic nasal pain and what can be done to manage this condition. Rhinoplasty is definitely not a piece of cake, and as in any other surgery, even in the best of hands, sometimes complications can happen. Unfortunately, you have developed chronic nasal pain after a nasal trauma or septorhinoplasty. Please contact your surgeon and related doctors regarding what treatment options can be considered. I really hope this video has broadened your perspective and given you a deepish dive about septorhinoplasty and the complications that can occur with the surgery. If you'd like more information about rhinoplasty or facial aesthetic surgery, please let me know in the comments below. Thank you for watching. Namaste.